We have a few minutes for questions. If you want to have some questions now, how do we do this? We put them on the screen or just raise your hands? What's the, all right? So the good news is that today we really have an armamentarium of tools, imaging tools, to really, in the majority of patients, figure out whether in fact they have a heart problem and then manage appropriately. The caution, which I think Dr. Kurrelmeyer made it very clearly, is that unfortunately these tools have to have a lot of expertise. And so the message to you all is be sure that if any doctor recommends any of these tools to you, that you check on expertise credentials, because unfortunately they're expensive, and we've had situations that we have to repeat a test that was done elsewhere, already spent a lot of money. Unfortunately, it was not well done, and we have to repeat it. So that's our message to you, is be careful and be sure that wherever you're going, that they have the expertise.
Thanks, Mike. We have a question over here.
How good is yoga exercise for you? Yoga.
It has been shown in multiple different studies to have health benefits and cardiovascular benefits, and specifically, you know, lowering stress and that sort of thing, because we know stress has a lot of adverse effects on the heart. So save that. You'll get a better answer later on this afternoon when we talk about yoga and nature and medicine.
You said that there's some 50% of the stress tests on the treadmill are positive, and it's kind of a false positive. Are there any false negatives that are done with the stress tests and they take them?
So absolutely, it's not as, there are going to be false negatives too. They're less likely though, because you saw that the false negative rate was right around 80% for both men and women. But you know, that still means that there is a chance there that you could miss, a small chance, but there's a chance that you could miss it. And as a cardiologist, we realize that. And so if the symptoms persist even after a normal treadmill ECG, well, it's time to go on to a test that has better ability to say you absolutely do not have it. So it's time to have one of those imaging tests.
And if we're frank and honest with you all, I tell you that us in our group, and I would say the majority of experienced cardiologists today, when they confront a woman, which after 45 years being a cardiologist, the one lesson I have learned about women is that they cannot be trusted. Everything Karla said is absolutely right. I would say that every single time that I have a patient that's a woman with symptoms, I always go, not sure, because of everything she said. Women experience symptoms so differently that truly we do depend a lot on testing. And to be frank with you, most of the time we go either for a stress echo or a stress nuclear because of all the limitations that she mentioned before of the very simple, inexpensive stress EKG. Yeah. You had a question?
It's very clear from the presentation. Thank you for such a great presentation. It's very clear from the presentation that the diagnostics and the technicians who are doing this, it's critical. So going on in your question is be careful where you go. Where do you go to where can you be assured? Do you go to a cardiac certified Methodist hospital like this? Excuse me, I'm not from here, but you know, some place that is really specialized in that, because your doctor will send you, of course, to the closest place or the place where you should go. How do you make that determination on whether it's a good place to go?
Now, you definitely want to have somebody that is board certified, that have an FACC next to their name. Those things are very helpful. But the truth of the matter is that most of the time, the problem is not with a false negative. So most of the time, these techniques, even when done in the office of doctors, you know, cardiologists with their boards and all that, if it's normal, it's normal. Most of the time, it's because they call an abnormality, and then we have to kind of recheck on that. So no test is perfect. Even in our hands, we will have false positive and false negative. And thank God for CTA, coronary CT angiography. That has helped tremendously define a little better. Now, if you're going to have a coronary CTA, definitely you want to be in a very good place. And definitely this will be one of the best in the country. That's not an office test. That definitely becomes then a very sophisticated hospital test.
So can you take your test results to get
Sure. Well, this is a typical scenario. Typical scenario, a woman presents with either minor symptoms or even sometimes no symptoms or minimal symptoms. They get the testing is positive, and the doctor said, I think we should have a cardiac catheterization. We often see those patients for second opinion, and then we end up doing something else. Sometimes we repeat the stress test, sometimes we go through a CTA, and surprise, or lo and behold, it's normal, and we can stop right there. So whenever you feel uncomfortable, somebody pushing you to have something like very aggressive, and you kind of don't feel so sick, yeah, it's not a bad idea to get a second opinion. Yeah. One more question, so we can go to our next topic.
So I'm not from this institution, but I'm well aware of your credentials and the level of cardiology that you have here. And what I would say is, from my experience, stratification of your population, the proper choice of the people you're going to be testing is probably one of the most significant things you could possibly do. And I think your group, the people here, are probably better at that than anybody else that I can think of. So the worry about a false negative is probably as low as it's ever going to be. Again, false positive is probably more the worry. But I mean, picking the right people to do the test on, and I've been in other institutions where there's no stratification. They just basically do it on everybody. And you want to avoid that, and I know you people don't practice that way. So,
I can assure you we didn't pay him to say that. Oh. And with that, we'll go to our next session.